Hello again, I'm Erin Cox, physiotherapist, and today we're going to talk about the first CMC ligaments. So at the thumb, the carpo-metacarpal. So I have a right hand here, my right hand, and the model right hand. So just to orient yourselves, so this would be my radius. Obviously we don't have one here, but we have the radial styloid. And as I come off the radial styloid, I'm going to be onto my scaphoid, which is going to be right here. So we have the scaphoid first, and then if we go along the metacarpal, the first metacarpal here, if I go between that styloid, the scaphoid, and just off the proximal side of the base of the first metacarpal, we're going to land on the trapezium. This is your first metacarpal. I've got writing on the back here to show you the dorsal surface. And I just put a little piece of tape here to show you the palmar surface. We're going to look at 4 different ligaments. There's the palmar oblique, the dorsal oblique, the radial collateral, and the ulnar collateral. So the palmar oblique and the dorsal oblique, obviously the palmar one is on the palmar side and the dorsal is on the dorsal, but they both end up attaching onto the ulnar side. So remember we said that the ulnar side of the thumb is going to be also, if we follow the anatomical position, the ulnar side of the thumb will be toward the ulna, and then the radial side will be on the radial side. So in our anatomical position like this, so it's going to go towards the middle of the hand or towards the rest of the hand. We have 2 ligaments that come off the palmar surface of the trapezium, and we have 2 that come off the dorsal. The 2 that come off the palmar surface of the trapezium is the palmar oblique and the ulnar collateral. The 2 that come off the dorsum of it will be the dorsal oblique and the radial collateral. So if we look at the palmar one first, and don't forget we're talking about here and not up here, it's going to be coming from the palmar surface and it's going to go all the way around towards the ulnar side of that first metacarpal base. Your dorsal oblique will be starting on the dorsal side, and it's going to go all the way around to the ulnar side of the base of the first metacarpal. Along with your palmar oblique, just going more medially, will be medial to the hand, the middle of the hand, but it's going to be the ulnar side. Will also be the little small ulnar collateral ligament, which we can't really palpate because it's like on the inside of the hand. But what we do have is the radial collateral ligament, which is going to be coming off the dorsal side here, and then it's going to be going toward the radial side of the base of the first metacarpal. So the ligaments that are on the palmar side, do you think they'd be more stressed in flexion or extension? Well, if they're off on the palmar side, they're going to be more stressed in extension. And remember, we said extension is going to go along the dorsal surface. So if you follow the thumb nail and go right along, then that's going to be your way of extension. So the palmar side is going to be more stressed in extension. And then your dorsal ligaments, so your dorsal oblique, is going to be stressed more in flexion. The ligaments are very short, so we can bias them with these movements, but then ultimately if we want to test them, we can use more of a gapping technique. I'm just going to show my screen now and share it with you so you can see the slides. So the first CMC ligaments, we have the palmar oblique, like I said, coming off the palmar surface of the trapezium, going toward the ulnar side of the base of the first metacarpal, and it's most taut in extension. It's wide, thin, and fairly loose. This is just another view. Again, it's taut in extension, but it's loosest in the resting position and in flexion. So in extension here, it would be more taut. Here we have the dorsal oblique ligament. So it's from the dorsal surface of the trapezium to the ulnar side of the first metacarpal. And the joins at the insertion of the palmar oblique and the intercarpal ligaments. The dorsal oblique, that should just be dorsal oblique, just one dorsal. It's the strongest and thickest ligament. It's loose in the resting position and in extension, and it's taut in flexion and as well as opposition, because opposition is a combined movement which will include flexion, a bit of abduction, and then, of course, internal rotation. The radial collateral ligament is strong and triangular, and it's also from the dorsal surface of the trapezium to the radial side of the first metacarpal. And here you see the radial collateral here, and this will be the dorsal oblique just beside it, and here's the rest of the hand. So you can see that there. The radial collateral, it's much thicker here. This, to give you a point of reference, is the abductor pollicis longus. And then here's the extensor carpi radialis longus, and then the dorsal oblique is just to the ulnar side of it. The ulnar collateral ligament, like I said, it's sort of squished in between the first and the second CMCs. It's from the palmar surface of the trapezium to the ulnar side of the first metacarpal. It's attached to the volar plate by an accessory ligament, and it is most taut in extension because it's coming off the palmar side. Here's another way to look at it, the ulnar collateral, and then we have the palmar oblique just beside it. The intercarpal ligaments obviously are between, inside, and we'll look at more of those later. Thank you.